What's up, guys? How many of you have absolutely atrocious posture, and because of this atrocious posture you have a lot of neck pain, back pain, shoulder pain, things just got hurt all over this area? Now we have this whole chunk of musculature down our necks and upper backs called our trapezius, also known as the traps, right? And this stuff, its primary purpose is to really help you to hold up good posture. It helps to hold up your head, your 5-kilo head or your 10-pound head, and keep it in position. But if you are constantly failing the fight against gravity, you're overstretching these tissues. They tend to become massively weak. They tend to become extremely fibrotic and really painful. So what we want to be doing, guys, is having this daily practice of trying to undo that tension. Because we all know this point right here. If we go at the corner, at the junction of our neck and shoulder, that area that tends to be so stiff and tight, you really want a loved one to come up behind you and just massage their thumbs into these two spots at the corner of your neck and shoulder. You know what I'm talking about, right? So if we can massage out this area, really get things loosened up, and then we can do some work to help to open up our neck, actually open up the neck vertebrae, your cervical vertebrae, so that things can move around a lot better and feel a lot better. So 2 minutes on each thing here, guys. I'm gonna start off with a foam roller, and I actually prefer, especially when you're new at this kind of thing, to use a foam roller over a massage therapy ball, because we should always be thinking, be delicate, be careful with the amount of pressure, and always control the amount of pressure you're using. But the broadness of a foam roller helps you to get into the entire area a little bit better. And you can do this on the wall. I'm going to show it on the floor. It tends to be a little bit more overall comfortable and easy for people to get into, but play around, see what works well for you. But basically, you can take your foam roller and you're just putting it towards the back side. So it'll be at a bit of an angle like that, but you're just thinking, here's my collarbone. If I go back behind it, there's my upper traps. So if I go a little bit further, there's my shoulder blade. I want to be just ahead of that. So in between the shoulder blade and my collarbone, that's where you're massaging out. So foam roller goes up there. I'm going to lay down at an angle. So I'm at a 45-degree angle. I'm on my side, a little bit on my back, and I can keep my hips on the ground and just move side to side, up and down, nice and slow. And guys, number one point here, relax your head. Keep your head as relaxed as possible. Now, if you're going through this and you've gone through a minute and it's like, hey, that feels good, it's not painful at all, maybe we can get a little bit deeper into the tissues to have a greater effect. And if you can breathe just fine doing this and use your hips to create a more upside down position and therefore more pressure on the foam roller. And try not to be too much on your neck. Remember, you're going at the junction, at the corner of your neck and shoulder, so make sure you're right on that upper trap. And again, this tends to be a little bit easier with the foam roller because it's big and broad. Whereas when you're on a ball, it can be a little bit more of a balancing act, and it tends to go in so deep that it's really hard to keep control of your body weight, your body pressure, and it may be more beneficial just to actually use your own hand. So actually holding a massage therapy ball and just putting it in there yourself, but then you can't relax your shoulders as much. So play around with that. Go use the wall if you need to, and honestly, getting off of that and moving my head around, oh man, you can really feel how much looser one side is, even just doing that for that few seconds. Normally you want to do 2 minutes. Do 2 minutes on one side, get up, move your head and shoulders around, and feel how different it is side to side. Now next up, we're going to assume I've done both sides, right? Next up, we're going to grab our resistance band, and we're going to do what's called a joint distraction on our neck, on our vertebra, the joints in the neck. So 2 ways of doing this. I'm going to show you the first way, and this is really personal preference. The first iteration when you're standing up is a little bit easier for some people if maybe you can't get on and off the floor as easily. But if I put both of my feet into the band, as wide as you like, the wider you go, the more tension there's going to be, so you can modulate the tension in that way. And then the other end is going to come up around the neck, both hands on your knees, so you're just hinged over like you're about to do a deadlift, and then just move your head around. So nice and easy. If that is fine for you and you're okay with getting up and down off the ground just fine, you can lay down and feet out wide as you like. Hands underneath that, it's pulling your neck up instead of down into your torso. Also for the ladies, this will be a lot more comfortable than having it down across your chest like that, probably. But use that to adjust the angle to something that feels good. And again, just move your head around. Take some big, deep, slow breaths. Think you want to be breathing as slowly as you can. just like that. So I would go 2 minutes on that. So 6 total minutes for today's mobility work. 2 minutes on each shoulder and then 2 minutes around the neck. Easy peasy. If you suffer with chronic pain, chronic injuries, athletic injuries, I have got you covered. My name is Ethan Hammond, and I am a strength and rehab specialist. I work with people who want to return to sport and fitness, but feel that they can't because of pain and injuries. I've helped people with conditions such as lower back pain, ACL tears, shin splints, neck pain and chronic headaches, and so many more things. Now, a lot of you will be going through things like this, like what I just listed above, and you're saying that you cannot train anymore. Bullshit. You have got to train, and you've got to train right. Train or complain, that is the way this works. Now, I work in person in Southampton, England, but I have online services as well if you're a bit further out. And I also offer free consultations to get you started with a free game plan and strategy for getting out of pain. All you have to do is to send me a text or a WhatsApp message to 07 305 231 339, and I will personally get back to you in the next 24 hours to get you started on the road to proper recovery. If you are serious about leveling up and making real change, this is how you start.